my name's HAHoban. This is my health assessment video for class C349. Could you state your name for me and your age?
Michael Hoban, 19 years old.
And Michael, did you sign your consent prior to this video?
Yes.
Okay. Hi Michael, my name's Kathy. I see that you're here for a basic physical. Do you have any concerns before we get started that you would like to talk about?
No.
Okay. First thing I wanted to ask you was your weight and your height.
6 feet tall, 140 pounds.
6 feet tall, 140 pounds. Okay. All right, I'm going to start with your vital signs first. Okay, Michael? I'm going to check your radial pulse. Okay, your radial pulse is 68 and regular. Respirations were 20 and regular, unlabored. All right, I'm going to take your blood pressure. And while I'm getting this together, Michael, are you in any pain? Do you have any pain right now?
No.
Okay. All right, could you hold these 1 second? Just so I can wrap this around. I don't want it to hang from you. Okay, great. Thank you. (115/72). Thank you, Michael. 115/72. Okay, Michael, I'm just going to do a quick skin assessment on you. All right, your skin, Michael's skin is within defined limits for his race. There are no rashes, no edema, no swelling. His capillary refill is within defined limits. It's brisk. His nails are healthy. No signs of clubbing. No lesions. His skin is warm to the touch, dry. All right, let me just, swelling, which is capillary refill, positive. Okay, also let me check, there's no tenting on his skin. Snaps right back. All right, I'm going to check your head and your face, okay? So I'm going to start with the top of your head. Hair is evenly distributed and healthy. No signs of scaling, no bumps, no lesions. Do you have any pain when I touch your head?
No.
Could you open your mouth for me? All right, no TMJ noted, no lymph nodes. Temporal pulse is palpable. So normocephalic for his cranium. Also, I want to check it's called cranial nerve number 7. Can you smile for me? Can you show me your teeth? Can you puff up your cheeks? Can you frown? Raise your eyebrows for me. Okay, and frown and close your eyes. So cranial nerve number 7 is intact and everything is symmetrical. All right, so I'm going to check your eyes. Looking at Michael's eyes, there is no crusting, no discharge, no redness to his eyes. even eyebrow distribution, even eyelash distribution. Sclera of his eyes are white. No jaundice noted, no lesions, no redness. Okay, now I'm going to check your eye. All right, eyes are symmetrical. Like pupils are equal, round. Oh, I'm sorry, I forgot. All right, so millimeter wise, Michael is at a 6 millimeter at rest. Okay, look straight ahead at me, please. Michael's eyes are round, reactive, and accommodating to light as well as equal, and they are a 4 millimeter constricted. Okay, and bilaterally equal. All right, now I'm going to check your cranial nerve number 2. All right, could you cover one eye? I'm also going to cover an eye, and let me know when you see my light in the field, in your field of vision, okay?
No. No.
Okay, other eye, please.
No. No. No.
Okay, thank you. Okay, visual field full by confrontation. All right, now I'm going to check cranial nerve number 3, 4, and 6. Okay, just look at me, and follow my pen light, please. Okay, cranial nerve 3, 4, and 6 are intact, no nystagmus or strabismus. Okay, and just look straight ahead. Corneal light is symmetrical in both eyes. All right. Okay, so I'm going to look at your ears now, okay? So, Michael's right ear is intact. There are no lesions noted, no redness, no discharge. Michael's left ear, no lesions, no discharge, intact. Michael, do you have any ringing in your ears? Do you have any ringing in your ears? Do you have any, they call it vertigo? Are you ever dizzy or anything like that, or feel like you have water in your ears? Okay. Do they hurt when I touch them? Okay. So Michael's left ear is intact without lesions, no tenderness, no drainage noted. His right ear intact without lesions, no tenderness, no drainage noted. He does not complain of tenderness, earaches, tinnitus, or vertigo. And Michael, do you wear hearing aids?
No.
Michael does not wear hearing aids. I'm going to do a quick whisper test. Cover your ear, please. I'm just going to whisper into this ear.
Monday, Tuesday, Wednesday.
Cover your other ear, please.
ABC.
Whisper test is good. Now I'm going to look at Michael's nose. Looking at his nose, there's no drainage, no redness. It's symmetrical to his face. I'm going to check his septum. Okay, it's midline. I'm going to press on one nostril, breathe out of the other one. Okay. Okay. Both nares bilaterally are patent. Michael, do you have a history of nosebleeds?
No.
So no history of epistaxis? Okay. I'm going to check your mouth and your throat, okay? Lips look moist and they are pink. There's no signs of any lesions on his mouth or sores of any kind. His mucosa, open a little bit. His mucosa is moist and pink. All right. I'm going to look at your teeth. Open, please. Okay. His teeth are all intact. No signs of dental caries. Michael, could you tell me when your last dental visit was?
May 2019.
Okay, great. And Michael, how often do you brush your teeth daily?
Twice a day.
Okay. And how often do you floss?
Once a day.
Okay, great. There's no discoloration to Michael's teeth. The gingiva is moist. I see no signs of bleeding. Michael, do your teeth bleed when you brush?
No.
Okay. No signs of bleeding. I'm going to check cranial nerve number 9 and 10. Open, please. Stick your tongue out. Say ah. Okay. Uvula is midline. I'm going to check his gag reflex. Just go like this. Gag reflex is present. Uvula is intact and midline. All right. So next we are going to check the carotid pulse. Left carotid pulse, present and palpable. Right carotid pulse, present and palpable. Going to check his trachea is midline. Swallow, please. And does not deviate. Thank you. Okay, so I'm going to do the range of motion for cranial nerve number 11. So could you tilt your chin to your chest, your head back? Can you turn your head, and then bend your head over and again, and then shrug your shoulders. Now we're going to do it against resistance. Shrug your shoulders, head sideways, sideways, turn please, turn, head forward, and head backwards. Okay? Michael has full range of motion and muscle strength for cranial nerve number 11. So full range of motion, trachea was midline, carotid, palpable one at a time, and able to shrug against resistance. Okay, I'm going to check your posterior, which would be your back, okay? And could you swing yourself around for me, please? Okay, Michael. Okay. His posterior chest looks symmetrical. Could you take a deep breath in for me? Okay. Diaphragmatic expansion is symmetrical. No barrel chest noted. No use of accessory muscles. And let's see. Now I'm going to check for tactile fremitus. When I place my hands on you, could you please say 99?
99. 99. 99.
No tactile fremitus present bilaterally. I see no lumps or tenderness. Does anything in here hurt, Michael?
No.
Okay. No lumps, no tenderness. I'm going to listen to your breath sounds. All right, Michael, when I put the stethoscope on, could you just take a deep breath for me? Deep breath. Deep breath. Okay. And again. Okay, thank you. All lung sounds are vesicular. No signs of bronchi, crackles, wheezing. I'm going to check CVA angle tenderness at the 12th, let's see, about the 12th rib next to the spine. Anything tender in here?
No.
How about in here?
No.
Okay. Non-tender CVA. Could you turn back around for me, Michael? First going to do the same thing for the 99 when I put my hands on. Say 99.
99. 99. 99.
Okay. No tactile fremitus present. Bilaterally. Okay. I'm going to listen to your breath sounds on the front. Okay. When I place my stethoscope, please take a deep breath. sorry, one more time. Again. And again. Vestibular breath sounds bilaterally in all lobes. No signs of rhonchi, crackles, wheezes. Okay, now I'm going to check your apical pulse. If you could sit straight up, I'm going to go to your 5th intercostal space. Apical pulse is palpable. Okay. I'm going to listen to the heart rate for 1 minute. '79 is apical pulse, and it's regular rhythm. I'm going to listen for hard sounds, first using the diaphragm. And then the bell. S1 and S2 are present with the bell and diaphragm, no murmur indicated. Okay, I'm going to check the range of motion in your upper extremities. If you could put your arms out, hands back, hands forward, arms up, arms down, behind your head, behind your back, across your body, and then across your body. Okay. Michael has full range of motion bilaterally, equal bilaterally. Oh, could you put your arms out, please? Can you bend them? Okay. Can you put, no, this way? Could you push again? And could you pull forward? Okay, great. Right? He's strong bilaterally, full range of motion bilaterally in his upper extremities. Now I'm going to check his pulses. Your brachial pulse. It's a +2. Radial pulse. +2. +2 bilaterally and equal. Okay. +2. Okay, Michael, could you please lay back for me? Alright, so put Michael in a supine position. No jugular vein distension on the right side, no jugular vein distension on the left side. Okay, Michael's, can I pull this up please? Okay, thank you. All right, I'm going to check your abdomen now. Michael's umbilicus is midline. His umbilicus is inverted. I'm going to listen to your bow sounds within all 4 quadrants. Right lower, right upper, left upper, and left lower. Bow sounds are present in all 4 quadrant and normoactive. All right. Now I'm going to palpate lightly. Tell me if there's any tenderness or pain. Any tenderness
No.
with me pushing? Okay. I feel no masses. It's soft and non-tender in all 4 quadrants. I'm going to do a deeper palpation. Let me know if anything hurts, please. Does anything hurt?
No.
Okay, no signs of tenderness. His abdomen is soft in all 4 quadrants. And then I'm going to percuss. Tympany in all 4 quadrants, no dullness noted. All right, now I'm going to check your lower extremities, okay? If you would be so kind. Oh, sorry, thank you. So, the lower extremities hair distribution is equal bilaterally. The color of the skin is within defined limits of his race. No varicosities, no lumps, bumps, no erythema, no edema noted. Okay. Popliteal pulses, +2 bilaterally. Posterior, just a little, could you spread your legs just a tiny bit? That's all. Thank you. Posterior tibialis, +2 bilaterally. Dorsalis pedis, +2 bilaterally. Nails of the toes, capillary refill is brisk. The nails are healthy. There's no clubbing, no signs of trauma, no lesions between the toes. Everything there looks within defined limits. Michael, can you pull your feet back towards your shins, please? And then push your toes forward. Can you rotate your ankles inward? And rotate your ankles outward. Okay, great. All right, so Michael's skin is symmetrical, no signs of cyanosis, ulcers, lesions, or varicosities, no erythema, and no pallor noted. Hair is evenly distributed, brisk capillary refill bilaterally. The temperature of his skin is warm and dry. I already said no edema noted bilaterally. Femoral pulse, or I'm sorry, yeah, no, I didn't check the femoral pulse, excuse me. Femoral pulse is a +2 bilaterally. So femoral pulse, popliteal, posterior tibialis, and dorsalis pedis, all pulses are +2 and within defined limits. All right, now I'm going to just check your hips. Does anything in your hips hurt when I press down?
No.
Okay. All right, Michael, I want to check the range of motion in your hips. So if you would, please, could you pick your left leg up straight? Okay. So it lifts, it goes to a 90 degree and a 120 degree bent. Again with your right, 90 degree and 120 degree. All right, Michael, let me see. Okay, could you bring your leg out for abduction out again on that side, okay, for abduction. That was 45 degrees, and we're gonna do an internal rotation. Bend, please. And just lay your internal rotation 45 degrees, external rotation 40 degrees. We'll do the other leg. Internal rotation 45 and external rotation 45. No pain, Michael?
No.
Okay. Range of motion for flexion, abduction, internal and external rotation are all within defined limits. There's no pain, no tenderness, and no crepitation. Okay. I checked your feet. I already said there's no swelling. We did range of motion. So range of motion and strength in Michael's feet are all within defined limits. No ulcers, no redness, no edema, no pain, and no tenderness. Okay, I'm going to return you back to a sitting position, Michael. And I'm going to check your deep tendon reflexes. All right. So first I'm going to check Michael's right bicep, Michael's tricep, radial brachialis, which is about 2 inches above the wrist. Okay. I'm also going to check his patellar and his Achilles. Okay. We'll do the left side as well, Michael. So I'm just gonna go 2 inches up. Okay. Patellar, Achilles. Okay. Left and right bilateral deep tendon reflexes are within defined limits on a +2. All right. Now, Michael, could you close your eyes? I'm going to do light touch sensation, and just say yes if you feel me touching your face.
Yes. 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 Yes.
Okay. Michael has sensation for light touch in his face, arms, hands, legs, and feet. So that's positive. Okay. Michael, could you stand up for me? All right. I'm going to check your spine. Just move up a tiny bit for me. All right. Could you bend over and touch your toes? Michael has full range of motion at a 90-degree angle. His spine looks straight. Okay. Thank you. Now I need you to like bend at the waist, like, yep, and then bend the other way. Could you twist at the waist, please? And again, Michael, do you feel any pain?
No.
Okay. Michael can twist at a 30-degree angle. He can also bend at 35 degrees, and he can touch his toes at a 90-degree angle. Michael, could you step back towards me? I'm going to need you to walk on your heels. Just take like 3 steps on your heels. Okay? And then 3 steps on your tippy toes. Michael has appropriate coordination on his heels and his tippy toes. Okay? And I think, okay, Michael, you can sit back down. All right, Michael, we're finished with your head to toe assessment. I appreciate you coming in today and working with me. If you have any questions or any concerns, you can follow up with your doctor within the next couple of weeks. Are there any questions you have for me?
No.
Okay, great. Michael, I really want to thank you for coming out today and participating in this. I appreciate it, and I hope you have a wonderful day.
Thanks.
You're welcome.